Hi everybody, I'm Nathan Becker.
I'm Michael Sahebi.
I'm Ethan Davis.
We are part of the 2019 University of Central Florida Doctor of Physical Therapy program.
We're here to talk to you today about our Capstone project entitled Deterioration in Skeletal Muscle, Size and Quality Following Short-Term Limb Immobilization. In the current literature, there is a large amount of evidence regarding atrophy following disuse of the muscle in a situation of long-term immobilization or hospitalization. However, there is a gap in the literature when it comes to echo intensity following short-term muscle disuse.
An echo intensity is an imaging analysis that allows investigators to quantify muscle quality using a grayscale analysis, with darker images more indicative of higher quality muscle and lighter images indicative of an increase in infiltration of adipose tissue and non-contractile connective tissue.
The purpose of our study was to utilize ultrasound to quantify muscle quality and cross-sectional area of the rectus femoris and vastus lateralis muscle following 2 weeks of immobilization in college-aged women.
Our study initially enrolled 26 college-aged healthy women from the University of Central Florida student body who were free from metabolic or muscular disease, also free from a history of DVT. Our study was approved by the Institutional Review Board. Following incompliance and dropout, our final data set consisted of 13 participants.
Our participants were fitted with a knee immobilizer, fixed to 90 degrees of knee flexion to avoid weight bearing, and also fitted and trained with crutches so that they would not weight bear through the left lower extremity. Additionally, we advised them not to perform any weight-bearing activities throughout the study.
Our participants were provided with a shower chair to ensure non-weight bearing while they took a shower and also for safety precautions while they were doing it as well. They were also provided with compression stockings that provided comfort while the brace was on top of it, as well as provided some compression to prevent any complications that could come along with disuse. Finally, our patients were provided with accelerometers that were worn 24 hours a day on both lower extremities to ensure compliance with the study.
Participants were given a home exercise program that was to be done twice daily, consisting of ankle pumps and knee slides in order to improve lower extremity blood flow and prevent any complications that may arise from disuse immobilization.
Participants were provided with a point of contact with someone associated with the study who would contact them on a daily basis to answer any questions, make sure they are following protocols of the study, and to ensure compliance.
Transverse plane ultrasound images of the vastus lateralis and rectus femoris were taken on the controlled limb and immobilized limb at pre-test and following 2 weeks of disuse immobilization. All images were analyzed using ImageJ software and by the same investigator throughout to assess cross-sectional area and muscle echo intensity. Our study utilized repeated measures ANOVA to examine limb by muscle differences across time.
Upon statistical analysis, we found there was no change regarding cross-sectional area or echo intensity of both muscles on the control leg.
For the immobilized limb, there was no significant differences found for the cross-sectional area of the rectus femoris. However, 4 of the 13 participants displayed a decrease that exceeded the minimal detectable change. And as far as the vastus lateralis, there was a decrease in cross-sectional area that was associated with a moderate effect size of a Cohen's 0.57. Also, 5 of the 13 participants displayed a decrease in cross-sectional area that exceeded the minimal detectable change.
Our results for echo intensity was particularly interesting. In the immobilized limb, echo intensity for the vastus lateralis was significantly increased with a large effect size of 0.808. No changes were noted in the rectus femoris. This is particularly interesting because of its role as a 2-joint muscle.
We found it particularly fascinating that the change in echo intensity and the change in cross-sectional area were strongly correlated in both muscles. Some of the limitations of our study included a small sample size. Also, although our participants were provided with a food log, there is no way to control for dietary intake. Finally, they are also provided with accelerometers, but there was no way to completely control for 100% compliance.
Overall, the study revealed that following short-term disuse immobilization, muscle quality deteriorates more so than muscle size in the vastus lateralis of college-age women. Based on our findings, echo intensity can be a useful clinical tool in tracking muscular changes following disuse.